Well, in regards to capillary bloodstream infections, these are a major concern for hospitals. One, because of the morbidity and mortality associated with them for patients, which is number one. Number two, these are really considered never events and have become an issue of reimbursement for many hospitals. With antibiotic lock therapy, this offers a local installation of a concentrated antibiotic into the catheter itself or the IV line, which will either prevent infection from occurring. Many institutions have gone to this in patients that have to have long-term IVs. So these could be patients on dialysis machine or artificial kidney. These could be cancer patients requiring chemotherapy. It could be patients that require to be fed through an IV line, such as total parenteral nutrition. So the antibiotic lock therapy will prevent bacteria from adhering to these catheters, these IV lines, and preventing infection. The immune system is very complex, but one of the biggest keys to your immune system is the good bacteria that live in your gut. And when you take antibiotics for any type of infection, I use the example of sinusitis. The antibiotics don't know to go just to your sinuses to treat the infection. They unfortunately will kill the good bacteria in your gut as well. When they do that, you offer the opportunity for bad bacteria, such as this Clostridium difficile, to invade the gut and cause an active infection. What this looks like is a very, very severe diarrhea, but it can lead to severe colitis, and in some patients, they have to have part or all of their colon removed. So it can be a very severe infection. In many hospitals, it's actually become the most common hospital-acquired infection to date. So what we're doing is looking at identifying local risk factors, which are antibiotics, but more specifically, which antibiotics, which combination of antibiotics, and for how long do you need to be exposed to these antibiotics to develop this infection. From that, it will allow us to target our interventions to reduce the risk of exposure by changing those antibiotic patterns. So when we notice those antibiotics have been started, we can make an intervention to help change those antibiotics or reduce the amount of time that you're exposed to them, thus reducing your risk of getting this Clostridium infection. So we've looked at the last 4 decades of pharmacist portrayal as characters in television shows and movies, and unfortunately what we found is that nearly 2/3 of these portrayals were considered negative portrayals. These were oftentimes the pharmacist was the victim of a crime, or less frequently, but unfortunately, the villain themselves. I think this speaks a little bit to the public perception of pharmacists. Many folks don't understand that a pharmacist goes well beyond the counting to 5s behind the counter, sending someone else to ring you up and send you on your way, or just simply providing over-the-counter medication recommendations. Pharmacists are trained to be the medication experts as part of that healthcare team, along with physicians, nurses, public health officials, and other healthcare workers. As a profession, what we hope to drive home is pharmacists themselves really need to be vocal proponents of what they can do in providing health and wellness counseling, providing a benefit to medication safety and medication effectiveness, prevention of infections for the public.